According to the CDC, about 1 in 59 children have been identified with autism spectrum disorder, and parents and caregivers now have a place to turn for help. Ochsner's Boh Center for Child Development opened last fall and is dedicated to improving the lives of children and adolescents with developmental disorders, including autism. Joining us now with more is child and adolescent psychologist Dr. Lacey Seymour and board-certified behavioral analyst Sally Goodry. Thank you for being here, ladies.
Thank you for having us.
Of course. So starting out, what is autism spectrum disorder?
So autism is a developmental disorder. It's characterized by challenges with language, with social skill deficits, and the presence of repetitive behavior. So children tend to do the same thing over and over again. It's oftentimes associated with medical conditions such as seizure disorders, sleep disorders, and gastrointestinal difficulties. We also see some sensory skill deficits or some sensory challenges, and also some mental health challenges as well. So anxiety, depression, and attention problems.
So are these the signs of autism, or is that another classification entirely?
There are some signs that we would look for. The signs are typically evident around 2 to 3 years of age, but we can diagnose as early as 18 months. And so it's important for parents to be aware of developmental milestones. So there are several signs and symptoms that would be really apparent that would warrant a conversation with your pediatrician. If by 1 year of age your child isn't speaking at all, if they're not responding to their name, if they're not following a point or waving hello or goodbye, if they're not engaging or playing appropriately with their toys, if they're just doing the same thing over and over rather than giving or showing objects, or if at any point in time they stop speaking or stop looking at you, or you see a loss in skills or regression in skills, then it's important that you speak to your pediatrician about that.
I see. And so what local resources and treatment options are there for children with autism?
So as you mentioned, when we first began in fall of last year, Ochsner opened the Boh Center for Child Development, and the mission of the center is to provide multidisciplinary care to young children and adolescents with developmental disabilities, including those with autism. And so it can be beneficial for kids with autism to see a developmental pediatrician, someone who specializes in developmental disabilities and disorders, or a psychologist like Dr. Seymour, who can diagnose autism and then provide some treatment. The center also provides speech and language services, occupational therapy, physical therapy. Those kind of services are very often recommended to young kids with autism. My position at the center is to provide family training, and so my specialty is applied behavior analysis, which is one of the most effective treatments for young kids with autism. So in family training, parents come and we talk about what are some ways you can help encourage communication development in your child? What are some ways you can improve your child's attention and focus? And if your child's exhibiting some behavioral challenges, what are ways we can work with you to remediate those deficits?
Wonderful. So the child and parent or guardian is involved in the process.
Yes, exactly.
How important is that dual involvement?
It's very important. Parents are their child's best advocate. They're the one who's going to be with their child throughout their lifespan and meet all of the professionals that are going to be in their child's life to help them. And we really want to empower parents and give them the same knowledge the professionals have.
Sure, wonderful. And it would seem that these statistics are relatively new as far as just learning about how many children really do have autism and are diagnosed with autism. Has autism perhaps always been there and now we're just sort of figuring out how to treat it?
Yes, I think there's a multitude of factors that are affecting the levels of autism that we're seeing in our community. I think one is absolutely recognition, but there's a lot of research going into what are the factors, because it is multifactorial, that contribute to autism developing in children. And it is a spectrum, so some kids are much more severe than others. In adults, we have a lot of young adults in our community too with autism, and that's one of the challenges that we're seeing, and something that we're actively addressing at the Boh Center is how can we help service those kids as well, or young adults now.
Sure, and you mentioned the spectrum in and of itself. Is this a genetic situation?
Yes, we do know, the research has said or has shown rather, that there is a genetic component involved, and so a multitude of genetics involved oftentimes, and so as I said, we're actively looking at what's going on there.
Right, wonderful. Any tips for parents who maybe are noticing these repetitive behaviors that you mentioned?
Well, I would suggest having your child evaluated as soon as possible. One of the things that we try to actively encourage parents to do is seek early intervention services. The longer we wait, the harder it is to address some of these deficits in kids, and so we really encourage them to be active in seeking out treatment, evaluation, and treatment.
Wonderful. And what is the end goal?
rehabilitation. The end goal is to have a child who is functional and who can get everything that they need from their world. And so we really want to help with language. Without language, they have trouble accessing their world. Without being able to pay attention and to learn, they're going to have trouble. So the end goal is to support families as much as we possibly can.
Wonderful. Anything else you'd like to add today, ladies?
If anyone's interested in seeking family training or any of our other services, they can contact our center and we can give you more information.
Perfect. Yeah. All right. Thank you both so much for being here today.
Thank you so much.
So to learn more, you can visit ochsner.org/boh. You can call 504-842-3900 or visit them at 1319 Jefferson Highway.